In part one, we talked about when it's time to start over and why keeping a few good teeth isn't always the best option. In this video, we break down dentures, why they feel bulky, lose function, and now how this new prosthesis can change the game.
I've seen that quite a bit chairside with patients where they say it feels bulky
The
and
biggest one is
yeah,
tasting the food.
yeah, they can't taste the food because it covers the palate, and then they can't feel hot and cold. That's a lot of the complaints I hear. And just to give you a little bit of statistics, is that dentures is only 5-10% functionality of your natural teeth compared to your natural teeth. Because if your natural teeth is 100%, dentures is only 5-10% functionality. And I see a lot of patients who complain that it's moving, slipping, there's sore spots. And by the way, that's one question I had is what does it do to your tissue if you have dentures on for quite a bit of time?
Of course, especially ill-fitting denture, the ones that move and rub against the gum will cause inflammation, will cause sores, will cause the bone to go away, and then you will have a lot of flappy tissue that even make the denture process, if you want to get a new denture, much more complicated.
Okay.
You have to go through surgery to remove that or adjust the bone.
Okay.
If you have any sharp bone edges that needs to be smoothened before that, so
Okay.
it complicates things.
So when you say flappy, what do you mean by that? Like flappy?
It means like a spongy tissue between the denture and the bone. And it's your own tissue, spongy gums between the denture and the bone.
So what does that exactly do? The flappy, spongy, what does that do
So
to the dentures?
that would make the denture even move without itself, without
see.
moving itself. Like
Okay. So the flappy tissue itself will move and not the denture.
Yes.
And that's where you have, mobility with the dentures. I didn't know that. I've been in this field for like 20 years. I didn't know that. That your tissue itself can move. I see why, functionality can drop quite a bit. And it resorbs quite a bit too, right? The tissue over time, if you use dentures for quite a bit, your bone starts to resorb. And I believe that if you at least have implants to stimulate that bone, you won't lose that bone, right?
Yes.
Is that correct?
If everything is kept healthy, implants are good and healthy, you clean around them, you go to your dentist regularly to take care of them.
Okay.
They stimulate and help maintain your bone volume.
Okay. So dentures is a solution, but you have to be wary of the mobility, the functionality, and the bulkiness. As a dental technician, when we're working with materials, we are working with making sure that it doesn't break, and there's a minimum thickness we can get to when we make dentures. And I have a lot of patients complain, can we make this thinner? But if we make them thinner, it's going to break. So there are limitations with dentures. But again, if cost is an issue, yes, dentures probably be the best bet, right? Like rather than having no teeth at all, you'll probably want something, I think, when it comes to dentures. And I guess that's my take on dentures. So my next question is snap-in dentures, right? What is snap-in dentures? Snap-in dentures is we will place implants, but compared to just dentures where it just comes right off, snap-in dentures, we can snap it into the implants that we place, right? Now, some people have heard about these snap dentures. The ones that click into place, how do those actually work? And do they really stay put when someone's eating and talking?
So a regular denture, imagine it as a suction cup. Basically, have a good seal around the tissue and it stays in place that way. Still, especially for the bottom teeth, bottom dentures, you have your tongue moving everywhere and pushing that denture away and cutting that seal.
Yeah.
With the denture on top, like you have to include all the roof of the mouth to get a good seal on it. That's why people don't taste food that much. So there is a big upgrade from that where we place 2 to 4 implants, it depends on the case. And those will have like clips that will click to the denture. So the denture is getting most of the retention, not from the tissue, but from the implants. And it's definitely a great upgrade from the regular denture.
Got it. In the dental technician's view, when it comes to snap-on dentures, it is definitely a lot more firm, and it doesn't move quite a bit as dentures. So, according to some statistics, the functionality now jumps to about 60-70%, but there is still mobility based on where the implants are. Of course, we will try our best to place implants to give the maximum support for the snap-on dentures, but sometimes I think the sinus, there's no bone under your sinus area. We can't place implants back there. So if we place implants towards the front of your mouth, now you're going to have a little bit of mobility back and forward, right? I've seen this a lot. I've gone out a lot, repairing a lot of snap-on dentures. It still moves a little bit. You still get sore spots even with snap-on dentures.
So that's the big difference between snap-on dentures and hybrid. So basically, let's say we place 4 implants on both cases. For dentures, we have to have all the implants parallel to each other. So we have like the components, it comes in straight, and it has to click to that denture and to evenly, distribute the forces of your chewing. For hybrid cases, when we get like very close to the sinus, we can still angulate those implants to gain more spread of the implant and then adjust that with the abutments. So we get more spread, and that's how we can actually give you back teeth while the implant's position is not in the back.
So speaking of spread, for those who might not understand, is basically we're trying to place implants to have more support for the teeth. But with the snap-on dentures, we can't really angle the implants to gain more space. It has to be more parallel. That's the reason why with snap-on dentures, we can't really go back there. And if it's towards the front, it can move up, back and forward. And normally with snap-ons, as a dental technician, we like to still keep the palate in the functional, thinking about the functionality, because you get that suction, and it supports the denture better. But with the palate, you can't really, feel whether it's cold or hot as well. You can't really taste food as well. So that kind of defeats the purpose. And a lot of times we need to cut out the palate. And a lot of patients want us to do that. Now that weakens the snap-on denture, and it decreases the fit. So it'll move a little bit more. And if it moves a little bit more, you have food get caught underneath when it comes to these cases, right? And that's somewhat of the trade-off with cutting out the palate when it comes to snap-on. What do you think the biggest trade-off is, though, between dentures and snap-on dentures? I guess you have dentures. I'm thinking the biggest trade-off is you have more stability, but it costs more for sure because you still need to place implants. So what do you think the trade-off?
The most thing that my patients will feel happy about is not using the glue with the denture.
When it comes to snap-on.
And
that's a good one.
That's a big
one. Yeah. A lot of patients hate using the glue adhesives. It's super hard to take off. When we take records or scans of the patient's mouth, we have to make sure there's no adhesive there, but I have a really hard time taking that off.
It sticks to the gums.
It sticks very well. I mean, it's good. I mean, you can keep it, fixed in place quite well, but those are some of the trade-offs with snap-ons, but it still costs a lot more than dentures for sure, right?
Definitely.
So,
and their maintenance, they need a lot of maintenance as well. Going to the dentist.
I forgot about that. Yeah.
It's not metal on metal housing that they click to each other. There are some rubber components in the middle that wear off. So every 6 months to a year, those needs to be changed, adjusted, or even the whole housing inside needs to be changed.
Okay. Yes. So that housing, there's basically 3 parts. There's a metal housing that goes into your denture, and we're going to show it here as a 3D model. And then you have the abutment that's screwed onto the implant that's placed. So now you have the implant. So those are the three parts. So the housing itself, now there's a fourth part where there's a nylon plastic cap that goes into it. Over time, that's going to wear out. And depending on your chewing habits.
And that's part 2. Don't miss part 3. We're breaking down All on X and why it's becoming the top choice for patients.